topic of this video is wet macular degeneration. Macular degeneration is a condition that is primarily genetically determined. It is influenced by some environmental things such as diet, smoking, and high blood pressure. It comes in two varieties, dry and wet. In dry macular degeneration, the cells in the macula, the center part of the retina, drop out, they become thin, and resolution of reading and perception of facial features is degraded. In wet macular degeneration, blood vessels from a deeper layer grow up under the retina where they can leak and bleed and degrade vision, cause a central blur spot. This is a different form that requires a different treatment. In particular, we treat wet macular degeneration with injections of drugs into the eye to prevent further bleeding and leakage. The drugs typically used would be Avastin, Lucentis, and Eylea. They're all administered the same way. The surface of the eye is numbed up, and Q-tips or gel is placed against the white part of the eye near the cornea, and then after this is numb, betadine is used to sterilize this area, and a fine needle about the thickness of a hair is used to introduce the medicine actually into this gel inside the eye, and there it diffuses back to the retina where it has its action. Typically, this is not a one-time treatment. It has to be done multiple times, sometimes for the duration of life, and it's guided by studies like the OCT or the fluorescein angiogram. These are studies where scans are made of the retina to look for fluid cysts, and dye is injected into the arm vein to look for leakage of these blood vessels. These are used to guide treatment and indicate to the doctor if further shots are needed. Patients with wet macular degeneration need visits on a regular basis in an ongoing manner, and it's not uncommon for both eyes to eventually develop wet macular degeneration. Patients with dry macular degeneration look for changes in their grid, the Amsler grid, the test where they look at the straight lines and look for waves and bending and blind spots. And if they see these changes, then they should be checked immediately by their doctor to search for signs of leakage and bleeding. If you have other questions about macular degeneration, please read the document under that disease at this website.